Now let's say you do get the diagnosis of PCOS. Do you freak out like I did when I was 15 years old? No, you don't. And yes, you heard that correctly. Your girl has been diagnosed with PCOS for 10 years. And hey there, welcome to my channel, Bingo, it's Kimbo, where on Wednesdays we talk about reproductive health. My name is Kim, also known as Goodtoall Doctor to some, and this is a safe place for learning about and celebrating being a woman. If you haven't already, go ahead and click that subscribe button so you can join the Bingo Babe family. This week, we'll be covering a highly requested condition, one in which 1 in 10 women experience PCOS, which stands for Polycystic Ovarian Syndrome. I strongly encourage you to check out episode 2 of my Vagina Demystified series, a series which focused on the normal and not so normal conditions and discharges of the vagina, as that episode explores the menstrual cycle in depth. And trust me, you want to understand all the hormones involved in the menstrual cycle before even trying to understand what happens in PCOS. So what is PCOS? Well, before explaining that, let's first revisit what happens normally during ovulation. The female reproductive system consists of 2 ovaries, and within those ovaries are blood vessels, nerves, hormones, and ovarian follicles. In other words, sacs filled with immature eggs. The hormones produced by the ovary are 2 female hormones known as estrogen and progesterone, and 1 male hormone known as testosterone. Normally, the female hormones have a higher level compared to the male hormone. Every woman is born with between 1 million and 3 million eggs. And by the time she reaches puberty or her first menstruation, she has approximately 400,000 eggs left. These eggs are normally reabsorbed or released during the ovulatory phase of the menstrual cycle. This ovulation or release only can happen when the egg has matured enough to signal a specific hormone from the brain to stimulate its release from the ovary. After the egg is released, its sac, known as a follicular cyst, stays behind in the ovary and secretes progesterone in high levels, enabling the uterus to be maintained just in case pregnancy occurs. This follicular sac or cyst is also known as a simple cyst. This simple cyst is completely normal and happens in women at the time of ovulation and typically has no problem. However, there are some times where this simple cyst can cause complications such as discomfort if it gets large enough and erupts or ruptures. Now that we have covered those things, we can finally dive into PCOS. This syndrome is a disorder of hormonal imbalance and is typically seen in women of reproductive age, so any age between puberty and menopause. This hormonal balance predominantly involves a decrease in the female hormones, estrogen and progesterone, and an increase in the male hormones or androgens, most notably testosterone. In this syndrome, many follicles begin the maturation process as they normally do. However, because of the imbalance of hormones, commonly none of them are able to reach that level of maturation, which then will stimulate the ovulation process that we spoke about. The lack of ovulation or anovulation not only disrupts the menstrual cycle, resulting in no period, but it also affects the delicate balance of hormones that are a result of this menstrual cycle. This further contributes to a decrease in the female hormones and an increase in the male hormones. This is the basis, ladies and hopefully gents, of PCOS. And I say hopefully because really and truly this knowledge is important for both women and men to know, because men, you also know what men, you have sisters, mothers, aunties, significant others, daughters, and you knowing this really helps them. There are three main theories that contribute to the likelihood of the cause of this syndrome. One, genetics. There are many genes associated with PCOS. Also, there's a strong familial or genetic link between the mothers and daughters who have PCOS. In other words, if you have PCOS, it is likely that your daughter will have PCOS. And if you have PCOS, it's likely that your mother or your grandmother or auntie has PCOS. This is something that is seen in generation to generation for many persons. Two, insulin resistance. Now, up to 70% of women who have PCOS also have insulin resistance, meaning that their cells cannot use insulin properly. When cells can't use insulin to break down blood sugars properly, then the demand for insulin increases. As a result, the organ responsible for creating insulin, the pancreas, works overtime to produce more insulin. Now, the problem with this is insulin is a known trigger for androgen or male hormone production. So, more insulin in the body. Because of this link, it is strongly suggested that insulin resistance is associated with PCOS. Lastly, obesity. Now, obesity is associated not only with insulin resistance, but also with increased inflammation. And increased inflammation in the body is highly associated with an increased production of testosterone. Therefore, this link shows a possibility that obesity can also be a major cause of PCOS. Not to mention, a common symptom of PCOS is obesity. Since we are on the topic of symptoms, we might as well just dive right into it. Now, some women experience symptoms of PCOS at the inception of their menstrual cycles. Other women find out that they have PCOS when they find that they're gaining a lot of weight, and or they find that they have difficulty in getting pregnant. There are tons of reasons for infertility, but PCOS is one of them, and I'm going to explain why. One, irregular periods. Now, a lack of ovulation results in the inability for the uterus to shed its lining like it normally would. In other words, a lack of ovulation results in no period. In fact, some women with PCOS experience less than 8 periods a year. Now, you can only imagine the difficulty faced by someone who doesn't have 12 but only 8 periods. I mean, if there's no ovulation, there's no egg for the sperm to swim up to and fertilize it, resulting in a pregnancy. On the topic of irregular periods, that brings us to symptom number 2, heavy bleeding. That is when you actually do have a period, and that is sometimes. And this is because the uterus has a longer period of time to build up its lining. Rather than every month bleeding, 3 months of no period, that's a lot of blood for you to shed. And that's essentially why that happens sometimes. Other times the bleeding can be very light. 3, a male pattern of hair growth. Now, most people know this one. I am pretty sure you can identify at least one woman that you know that has a bit of extra hair either on her chin or right under her nose or right beneath her belly button, or even an excessive amount of hair growing in the bikini line. This is called hirsutism and is a result of the increased amount of male hormones in the female body. So you would find that there's a lot of pesky hairs in a lot of inconvenient places for women who have the condition of polycystic ovarian syndrome. I raise my hand because yes, y'all, I do have PCOS. Point number 4, acne. Ugh. Because of the increased male hormones, the skin in women who have PCOS tends to be a bit more oilier and more prone to getting clogged and resulting in a blemish. Point number 5, weight gain. Weight gain is like a hallmark symptom of PCOS. Up to 80% of women who have this syndrome are obese. Point number 6, baldness or hair thinning. Once again, because of the male hormone. Like this male hormone thing, it does not work. It is not working. You know when I say like, what else? Like what else does it cause? But yes, hair thinning and hair loss as a result of male hormones is something that women with PCOS can experience as well. Point number 7, darkening of the skin. Now, dark patches or general darkness or hyperpigmentation can occur pretty much anywhere, but most notably under the creases or around the creases of the skin, such as the underarm, the folds of the neck, under the breast. And this is really seen in patients who are of increased weight. And lastly, headaches. Headaches is another common symptom that women experience with PCOS due to hormonal imbalances. And please, if I left out any symptom that you experience if you are someone with the condition of PCOS, just comment it below and we can start a discussion in the comment section. Remember, this is a little forum, a little safe space for us to chat and get free medical advice. So go ahead and comment them below. All right, let's talk diagnosis. What does this entail? Well, a doctor's visit. And let me tell you all about this doctor's visit when you get comfy, because you should be comfy when you get there. So it will entail a detailed history. This history, we just want to get to know who you are. So how old are you? Your age of menarche, which is the age you had your first period. When was your last period? What your cycle is like how many days does it usually last? And are they irregular or are they painful? Do you have heavy bleeding or light bleeding? Do you have any symptoms associated with that bleeding or with your period, such as constipation, really bad abdominal cramps, and the works? We will also ask you about your history of contraception, as well as your mommy and grandmother and auntie's history, just to have an idea of if you're the only one that is experiencing what you're experiencing. Because remember what I told you, there's a strong genetic cause for this syndrome. So it's really getting to know you, and it's something that's really like stress-free. Trust me, just be open and be honest, and the doctor will be able to get to the bottom of your situation. The second thing it involves is a full body examination from head to toe, essentially, including a vaginal examination. Then it should include an ultrasound request and or a blood workup. Doctors typically diagnose women with 2 of these 3 symptoms. Number 1, irregular menstrual cycles. 2, high androgen levels, which are determined by blood tests detecting how much testosterone you have in your body. And 3, multiple cysts on the ovaries, which is confirmed by ultrasound. Now let's say you do get the diagnosis of PCOS. Do you freak out like I did when I was 15 years old? No, you don't. And yes, you heard that correctly. Your girl has been diagnosed with PCOS for 10 years. And let me tell you, it's been a journey that I am willing to share one day. I just don't want to make this video too long. And I really most notably want to share with you how I've minimized my PCOS symptoms to basically nothing. I digress. No, you do not freak out. You treat it. And treatment typically starts with lifestyle changes. These lifestyle changes include healthy diet, exercise, and an overall improved lifestyle and health regime. Now, losing up to 5 to 10% of your body weight when you are diagnosed with PCOS significantly improves your symptoms. If lifestyle management doesn't work for you, then your doctor may consider birth control. The use of birth control can restore hormonal balance, reduce symptoms, and regulate your menstrual cycle. This is because contraception methods typically contain estrogen or progesterone, the two hormones that are imbalanced that are causing the issue in the first place. So it's really important that you discuss with your doctor which form of contraception is best for you to alleviate your symptoms given your previous medical history and other concerns that you may have. And that is such a good video. Like every time I make these videos, I realize that there's so many other videos that I can make. Like I'm gonna have to do one on contraception. That's a good one, right? Comment below if you think that's a good one. Another form of management is medication for blood sugar level control, such as metformin. Now, metformin is a treatment for type 2 diabetes, something that is closely linked to obesity and insulin resistance. And as we've discussed, those things are all up in the mix of PCOS. Like it's just, they're like sisters, not even cousins, you know, close sisters, right? So that is typically something that's also seen in women with PCOS. Now, the use of metformin not only helps to control blood sugar levels, but it also helps to control insulin. And as we mentioned before, an increase in insulin results in an increase in male hormones. And male hormones is a problem. So if we can balance those things out, we got some progress going on. Not to mention the use of metformin in PCOS patients really helps with weight loss. That's a fact. We have reached the part of the video that speaks about PCOS tips, which predominantly surround eating habits and lifestyle changes that I incorporated and that research shows to really help minimize the symptoms associated with PCOS. Tip number 1, the rule of threes. Exercise a minimum of 30 minutes a day, 3 times a week. You can do it. In fact, I said a minimum. That is minimum. You can actually try to exercise more than that, but start with baby steps. Don't try to kill off yourself. 2, increase fiber intake. Now, fiber helps you to feel fuller for longer. Therefore, you minimize the risk of overeating. 3, increase your meal frequency. Yep, I know that sounds crazy, but hear me out. Smaller meals, more amount of times a day. This will help your metabolism like cray. Like your metabolism will be thanking you, loving on you, because you have given it the key to thrive. 4, avoid dairy products as much as possible. Several reasons, but in the case of PCOS, dairy can increase your insulin levels. And as we said, we don't need the insulin levels to be high because the androgens will be high and we don't want that. Point number 6, replace saturated fats with healthier fats such as omega-3 fatty acids found in fatty fish like salmon, avocados, and even dark chocolates. These healthy fats can reduce blood insulin, resulting in a decrease in testosterone levels. Point number 7, less carbs, more lean protein. Point number 8, water is your best friend. Water is your best friend even if you don't have PCOS. Water is your best friend once you're breathing. Water is life, like literally, it is life. And that's for a whole another philosophical video. And ladies, and hopefully gents, this brings us to the end of the video. I hope you found it very helpful. I have super fun making these videos. Like I really enjoy educating and pouring all the knowledge that I have to whoever is willing to receive the knowledge. Like, it genuinely makes me very happy. Don't forget to comment, like, share, and subscribe. And tune in every Wednesday to reproductive health videos by yours truly. I appreciate you all. Be blessed, and see you guys next week. Bye.